This is Chapter 6, Sexual Orientation and Heterosexism. So to begin with, we'll talk a little bit about sexual identity. So this includes physical identity, which would be something like biological sex. It includes gender identity, which is the belief a person has about his or her own gender. So this would be like the psychological sense of being male, female, both, or neither. Social sex role identity. This is gender roles that people adopt based on cultural norms for masculine and feminine behavior. And then sexual orientation identity, and this is a person's sexual and emotional attraction to members of the other and or the same sex. So there's 7 variables within sexual orientation. We have sexual behaviors, emotions, sexual fantasies, sexual attractions, social preference, living life as a heterosexual, bisexual, or gay or lesbian, and then self-identification. So heterosexuality, homosexuality, and bisexuality are all possible culminations of the process of sexual orientation identity development. We're going to talk a bit about that. So first we have some definitions from the textbook. So we have heterosexuality, and this is the most common sexual orientation identity, romantic or sexual attraction to members of the opposite gender. And like I said, this is the most common. Then we have homosexuality. This is an individual or group of people who have same-sex feelings and behavior. And this is actually no longer the preferred term. So it's something to keep in mind when you're working with your clients. We now say gay and lesbian. These are more acceptable terms because they're non-pathological. And then we have bisexuality. So here, romantic or sexual attraction to members of either the same or the opposite sex. And then questioning, this would be an individual who is questioning his or her sexual orientation and or gender identity. So within here, we have queer, which is a broad term, and that's anyone who does not identify as heterosexual, and many younger people use the term Q for this. So if you hear that term, that's what they're referring to. We also have pansexual. So these are individuals whose sexual and or affectional attractions are not limited based on gender identity or biological sex. Heteroflexible, so this is someone who identifies as primarily heterosexual, but they may engage in limited situational same-sex sexual behaviors, and they don't necessarily identify as bisexual. And then we have affectional orientation. So this is a suggested term to describe sexual minorities, so like LGBT individuals, because it broadens the discussion beyond sexual attraction. And the reason we're talking about all of these definitions is because this is really important when it comes to sexual orientation, this understanding of the language. There are a lot of terms here, new terms every day, and the more you know or familiar with, the more, once again, you can have a discussion with your client rather than being educated by your client every single session. So just being somewhat familiar with them. So historical resistance to heterosexism. So heterosexism, the definition from the textbook, is the oppression of LGBTQI individuals that involves prejudice and discriminatory behavior. So internalized heterosexism may emerge in counseling sessions as a comparison to a heterosexual norm, so this norm that we have in our society, and an overriding belief system that heterosexuals may be better than individuals who are LGBTQI. So the idea there is that that's within our social norm, that one is somehow better than the other. So internalized heterosexism often manifests itself within LGB clients as unrecognized shame. So if you have a client who identifies as LGB and there's some kind of unknown shame going on within your client, that might be something to explore, is this idea of internalized heterosexism and how that might be affecting them. Homophobia, the definition here is the fear and hatred of LGBTQI people. We may see hate crimes here, and it's recommended that you use the term homonegativity instead of homophobia. So once again, this idea of changing the language to be more inclusive and less pathological. So homonegativity as opposed to homophobia. And that might be something that comes up within the counseling relationship as well if you have a client who feels that they've been experiencing that. and maybe talking about it in terms of homonegativity to take away the pathology there that might help them to make sense of what's going on and not feel as pathologized. One of the most noteworthy historical events for members of the LGBTQI communities was the Stonewall Rebellion. This took place in 1969, and it's actually credited as starting the gay civil rights movement. So, police officers in New York City routinely raided this place called the Stonewall Inn, which was a gay establishment. And on June 28, 1969, patrons of the bar, who were primarily transgender people of color, actually decided to fight back against the police, and this challenged that systemic oppression. And it ended up lasting a few days. So it's important for counselors to know and teach LGBTQI clients about historical events of liberation movements, because this can be more empowering for your client and them understanding more about the history of their sexual orientation. So it also normalizes for clients the fact that throughout history, LGBTQI individuals have been oppressed. So intersections of heterosexism and classism. So once again, we're hearing this term intersectionality, intersections. So this is that profile that we've discussed. So individuals who are LGBTQI generally have more education than their heterosexual peers, and this may potentially lead to higher paying jobs. However, home ownership is lower for partnered lesbians and gays than for married heterosexual couples. And a part of this, so you have to think about, we have to critically think here. So many lesbian and gay couples actually choose to live in larger metropolitan cities because there's a greater tolerance there, and there we have homeownership is more difficult, it's more expensive, so you want to kind of look at all of the data there. Gay male couples have a higher mean household income than heterosexual couples have, and lesbian couples have lower mean household incomes than heterosexual couples. So we see that intersectionality between sexual orientation and gender there. So females tend to have lower incomes, and that's for a multitude of reasons, life decisions, career paths, chosen career paths. There's a lot going on there. Working class gay men may not have the resources to move to higher amenity gay neighborhoods, so that's something else to think about. These metropolitan areas that are more accepting, a gay client who is more working class doesn't make as much money as another gay client who is has a higher education, something like that. They may not be able to move into a metropolitan area, which may lead to more issues because they don't feel as accepted in the area, their environment that they're living in. So that's something else to keep in mind. And there's an increased likelihood of these individuals to experience psychological distress and physical violence because of that. So current attitudes. Homosexuality was listed as a mental disorder by the APA prior to 1973, so in one of the older versions of the DSM. Following a rigorous discussion of the 1973 decision of the American Psychiatric Association to remove homosexuality from its list of mental disorders, APA came out and stated, quote, homosexuality per se implies no impairment in judgment, stability, reliability, or general social or vocational capabilities, which we all know one of the main criteria for every single disorder is that it significantly impacts the client in a negative way. So they're not able to work or go to school or have social relationships, that kind of thing. So this is saying that being homosexual or gay, lesbian is now the preferred term, is not significantly impacting the individual in a negative way, thus taking away the pathology there. So many LGBT people are not protected from employment discrimination because of sexual orientation, because sexual orientation is not protected from Employment Discrimination Rights Act. Because it's not included in the federal Title VII of the Civil Rights Act of 1964. So this prohibits employment discrimination against other minority groups. However, like I said, the LGBT individuals are not covered under that. In 2014, 21 states and the District of Columbia prohibited discrimination based on sexual orientation, and of those states, 18 also prohibited discrimination based on gender identity. And then in 2015, 55% of Americans rated themselves as supporting same-sex marriage. So we've seen this shift over time in attitudes and the law. And this book's a little dated, so I'm sure there have been even more changes in the last 6 years or so. Lesbian, gay, and bisexual demography. So statistics do not include individuals who may be uncomfortable disclosing an LGBTQI identity, who have not yet realized that they're LGBTQI, and heterosexually married individuals who may actually identify as LGBTQI. So we have to keep that in mind, that these statistics are lacking. So this is kind of a general idea here. Same-sex intimate encounter does not necessarily constitute an LGBTQI identity, so that's another thing to keep in mind. It's difficult to accurately identify the precise number of individuals who do identify as LGBTQI because of all of this. So 2006-2008 survey for the National Center for Health Statistics, which included a pretty big sample size of about 13,000 Americans aged 15 to 44. So the results here showed that 6% of men and 12% of women had same-sex sexual experience by the age of 44. And 1% of women identified as lesbian and 3.5% as bisexual. And then we see that 2% of males identified as gay and 1% as bisexual. So, like we said earlier, the majority of American citizens do identify as heterosexual. It's estimated that there are 9 million LGBT individuals in the United States, so overall 3.5% of the U.S. population. So educational status. Individuals who are lesbian and gay do tend to have more formal education than their heterosexual peers. About 4 in 10 individuals who are LGBT have college degrees, and this is compared to about 3 in 10 non-LGBT individuals. But however, this still leaves about 60% of the LGBT population with no college degree, so that's something to keep in mind as well with your clients. Individuals who are LGBT are just as likely as heterosexuals to live in poverty, and this is evident by a recent report that LGBT Americans are less likely than non-LGBT individuals to be thriving financially. So there's a lack of protection against employment discrimination in some states, and that comes into play here. A lack of family support, and negative academic experiences that LGBT may experience as youth. And we'll talk a bit about this in more detail too, with the poverty and homelessness with LGBT youth in particular. Oh, here we go. So LGBT youth. So 74.1% of middle and high school students reported experiencing verbal harassment. And this is from a pretty big survey with about 7,900 middle and high school students. Within that, 36.2% reported physical harassment, 16.5% reported physical assault, 49% reported being harassed via text or social media, so we see higher rates of that in general across the board, but right now we're talking about LGBT youth. And the gay adolescent often exists in social, emotional, and informational isolation, so it's something to keep in mind. So some adolescents who are LGBT exist in, like I said, social, emotional, and informational isolation because teachers and other school staff do not take steps to protect them from a hostile environment. So that's kind of going into this idea that, what we're talking about, being more informed so that we're not being educated by our clients and we can help them. Teachers also need to step up and become more informed as well. So we have the Equal Access Act. So this states that it shall be unlawful for any secondary school which receives federal financial assistance to deny access or a fair opportunity to or discriminate against any students who wish to conduct a meeting on the basis of the religious, political, philosophical, or other content of the speech at such meetings. Then we have Title IX. So this is a federal statute that prohibits sex discrimination, including sexual harassment. Although Title IX does not provide protection against discrimination related to perceived sexual orientation. It does prohibit discrimination associated with gender identity and gender orientation if it is related to sex-based discrimination. So it's something to keep in mind if you have a client who is experiencing any harassment at school. So age and disclosure of sexual orientation. Lesbians and gay males in the US population are relatively young, with mean ages in the early 40s. Competent counselors should consider a client's emotional age as well as chronological age when strategizing effective interventions for youth who are LGBTQI. It's common for individuals who come out as LGBTQI in adulthood to experience a late adolescence that they did not have when most heterosexual peers went through adolescence. So that's something else to consider with your clients. They're kind of, everything's new, they're starting over again. Things that heterosexual peers experienced in middle and high school, they're just now experiencing as an adult. The average age of a person who comes out to others is about 25 years old. LGBT individuals are more likely to first come out to their mothers than their fathers. And there's this discrepancy is likely due to the stereotypical gender roles. So, for example, it's easier to come out to a mom because they're socialized to be nurturing and accepting. And then fathers are expected to be strong and masculine. So there's a greater fear there of being rejected by the father than by the mother. 10 to 15% are rejected by their parents, and this ends up being a big part of why a lot of LGBTQI youth end up homeless and struggling on the streets, that kind of thing. Cultural intersections of sexual orientation. So there is an issue of multiple oppressed statuses and several identity development tasks simultaneously. So that profile we talked about, there are some individuals may experience more negative interactions because of their said profile. So a phenomenon of double and triple minorities may exist. Individuals who have 2 to 3 oppressed statuses based on race, culture, gender, or sexual and affectional orientation, all occurring at the same time. So Morales in 1989 came up with a model. It was hypothesized, they hypothesized a model to apply to minorities within the gay community. So those individuals who are experiencing these multiple oppressed statuses at one time. So individuals moving through the following states, we have denial of conflict, so denying that there's an identity conflict at all. We have the second state would be labeling oneself as bisexual rather than lesbian or gay. Then being conflicted in allegiance between lesbian, gay, and ethnic communities. And then establishing priorities in allegiance. And lastly, integrating those multiple identities together. So we can see this like developmental model, basically. People of color who are LGBT may experience several of the preceding states simultaneously, so that's something to consider. And then it's consistent with research that ethnic and sexual identity development processes occur during similar periods, so late adolescence. So over 3/4 of individuals who are LGBT participate in religious organizations, most of which are Christian. So we have about 30% identifying as Protestant, about 20% as Catholic, about 17% as born-again Christian, about 3% as Wiccans and pagans, about 3% as Buddhist, and then about 1% who identifies Jewish. So the remaining quarter, so 24%-ish, identify as either atheist or agnostic, reporting none for their religious affiliation as well. So many queer individuals grow up in churches, mosques, or synagogues that they feel are abusing them. So abuse, quote from the textbook, would be when a religious group or leader, whether intentionally or unintentionally, uses coercion, threats, rejection, condemnation, or manipulations to force the individual into submission of the religious views about sexuality. So an example here would be messages about feeling dirty, becoming a child molester and engaging in shameful acts. So, consequences here of growing up hearing these messages include self loathing, the loss of close relationships, a poor body image, depression, and even suicide. So, some end up rejecting their LGBTQ identity altogether, others end up leaving their organized religion, and then others integrate both of these opposing identities. So, integration strategies might be changing one's beliefs, changing congregations or denominations, changing the degree of which they participate, or even changing to a new religious practice altogether. Addressing values conflicts. So, once again, it's important to practice competently. So, being aware of your own biases and serving your clients with care and respect. So, we'll just repeat that over and over again throughout the quarter. That's pretty foundational. And if you are able to do that, you're pretty set. You're good to go. So, ACA Code of Ethics in 2014 said that there's no discrimination on the basis of sexual orientation or gender identity. So, this is standard C5. You are to practice competently, standard C2A, and refrain from imposing your own values upon your client, so standard A4B. Appropriate termination referral, so this is something that comes up a lot, and I think I referenced this in the first lecture. So the counselor lacks competence to work with a certain population, standard A11A, then they can make a referral. But counselors must refrain from making referrals because of a counselor's personally held values, attitudes, beliefs, and behaviors. So that's standard A11B. So I believe, if I remember correctly, that's one of the newer standards, that second part, because a lot of counselors were using the first part as a loophole to avoid working with certain populations. So it had to be added because it wasn't obvious enough that you don't deny services to your client based on your own personal beliefs. So, that's our job. We're here to help anyone who needs help, regardless of their background or identity. Ward versus Wilbanks in 2010. So I think we referenced this in the first lecture. So Julia Ward was a practicum school counseling student. She was working with a client who was depressed and who also had issues related to their same-sex relationship. So Julia asked her supervisor for a referral because she didn't feel comfortable. And there's the ethics standard here that counselors cannot discriminate, so Ward was dismissed from the program. Services cannot be denied to a client based on the basis of the client's sexual orientation, nor can the client be referred to another counselor simply because of a values conflict with the client. So that's something to really keep in mind when you're working with your patients. So in general, individuals who are LGBTQI do seek out counseling more often than their heterosexual peers. And individuals who are LGBT are more likely than heterosexual individuals to experience depression, anxiety, suicide, and substance use disorders. So that's something else to keep in mind if you have a client who's LGBTQI that are presenting maybe with depression, something like that. You may want to screen for suicidal ideations, and then substance use. They may be using that as a maladaptive coping mechanism. So in general, LGBTQI individuals do disproportionately outrank heterosexual peers with their suicidal thoughts and past suicide attempts. They're 7 times more likely to attempt suicide. And suicide attempts are more likely during those developmental milestones associated with coming out. So, for example, first recognition of same-sex attraction, that can be very confusing. When they disclose their sexuality, that can be very stressful and traumatic at times. So you're more likely to see a suicide attempt at those milestones. Receiving mental health or medical treatment did not prevent suicide attempts, so that's something else to keep in mind with your LGBTQI clients. LGBTQI individuals who sought out religious or spiritual assistance were more likely to attempt suicide later than individuals who received no treatment at all. So that's something else to consider as well. Bisexual individuals often experience discrimination and intolerance from both heterosexual and gay communities. So if you have a client who states that they're bisexual, it's something else to also explore. There's a lack of sense of belonging, which often leads to feelings of isolation and loneliness, which in turn may result in an increased risk of depression and suicidal behavior. The risk for depression and suicidal behavior is exacerbated for people who are LGBTQI and persons of color. So something else to once again consider, and that kind of gets into that intersectionality and having multiple oppressed roles. So African American and Latino individuals who are LGB are at an increased risk for suicide attempts compared to whites. Suicidal ideation and attempts tend to be higher for Native Americans, Pacific Islanders, and those who identify as multiracial compared to Asian and African Americans. Stress and self-esteem. So another definition from the textbook is minority stress. And this is the extreme stress that is experienced among individuals from stigmatized social groups due to their minority social position. So there are three main sources for this type of stress. The first is chronic or acute outward events or conditions. So examples of this would be like bullying, slurs, that kind of thing. The second one is the expectation of discriminatory events and the anticipatory energy that this requires. So basically, this idea of being constantly on guard and experiencing chronic stress. And then the third is internalizing society's negative attitudes and feelings towards individuals who are lesbian, gay, or bisexual. And this is kind of getting into what we've discussed in the past as well with that chronic stress and how this can be corrosive. Having cortisol constantly running through one's veins can wear on the body and lead to more physical negative events as well as mental health problems. LGBTQI youth. So just like with other youths, this period of development can be fraught with many challenges related to identity development, the exploration of intimate relationships, and then the preparation for adulthood. So here you have that intersection of two different identities, so being a youth and then being an LGBTQI member, and that happening at the same time. So kind of double the issues. So LGBTQI youth often lack the needed coping strategies, as well as the support from family, teachers, and other potential adult role models. So that can be an issue that may come up in therapy, and you may become a sort of a role model to your client. About 85% of students who are LGBT were verbally harassed in the previous year, and about 39% reported being physically harassed at school over the same period because of their sexual orientation. So sexual minority children and youths are more likely than their heterosexual counterparts to be sexually abused or abused by a parent. So that's another thing to kind of keep your ears open for, and when you're doing your trauma assessment with an LGBTQI youth, you may want to feel out whether or not they've been abused by a parent because they're more likely to have been. Many LGBTQI youth do attempt to escape and self-medicate their feelings of worthlessness, depression, and anxiety by using substances, so another thing to look out for. There was a meta-analysis that the book references that had 18 studies, and they found that LGBT youth use substances at about 3 times the rate of their heterosexual peers. So there was a higher odd of youth using cocaine, so 3.27 to 1 odds, injection drugs 2.87 to 1 odds, cigarettes 2.76 to 1 odds, and alcohol 2.55 to 1 odds. So another thing to keep in mind. Many LGBTQI youth who experienced homophobic acts during their time in school reported increased levels of internalized homophobia, depressive symptoms, and anxiety symptoms that carried on into adulthood. So that's something else to think about. As a result of experiencing anti-gay abuse in their schools, many youth who are LGBTQI end up dropping out of school, and that's part of why you see that increased rate of homelessness within the LGBTQI youth community. Social consequences of heterosexism. So another definition from your textbook is negative stereotypes. Historically, gay men have been viewed as displaying feminine characteristics and rejecting masculine gender roles, while lesbians were seen as being more masculine, aggressive, and sexually deviant. So those are some negative stereotypes that we see there. Some studies examining mental health trainee stereotypes of individuals who are LGBTQI found that trainees believe that most have anxiety, personality disorders, mood issues, eating disorders, and sexual and gender identity disorders. So we do see some biases there. We also see people viewing a socioeconomic status of LGBTQI population as distorted. So many believe that they live an extravagant lifestyle because of the perception that they have excess financial resources. So this may come into play with this stereotype can contribute to the invisibility of poverty within this group. Many LGBTQI individuals actually can't afford to live in high amenity metropolitan cities that tend to be more accepting and tolerant of this community. So you see more of the working class LGBTQI community living in more rural locations, which may lead to increased perceived and actual discriminatory behavior. Homelessness. So many LGBTQI youths are kicked out of their homes when they come out, or they end up running away from homes that are abusive. Or, like I said, you see dropping out of school and that leading to homelessness as well. So between 30 to 40% of homeless youths do identify as LGBTQI. And whether they become homeless because of dropping out of school or they drop out of school because they are homeless, you see that occurring. So keep that in mind, and that can lead to them having a more difficult time to find employment and thus becoming financially stable. Institutional heterosexism. So the definition from your book here is that it references how anti-gay marriage laws were an example of institutional heterosexism, and these have since been overturned by the U.S. Supreme Court. And then diminished interpersonal relationships. So we see that internalized homophobia may prevent individuals who are LGBTQI from reaching out to and participating in the gay community because they may be afraid that they'd be identified as gay. Okay, so counseling strategies for addressing heterosexism. In 1998, both the ACA, American Counseling Association, and the APA, American Psychological Association, passed resolutions opposing prior conceptions that people who are LGBT, by their very nature, have mental disorders. So efforts to alter same-sex or affectional orientations did begin in the mid-1800s. So formally, we saw reparative therapy, so that was psychological approaches that aim to alter or repair sexual orientation from LGBT to heterosexual. So we also saw conversion therapy as well. A lot of you may be familiar with that. So those are attempts to convert individuals from LGBT to heterosexual. The current umbrella term used to describe any of these methods to change sexual orientation is sexual orientation change efforts, so SOCE. Examples in the past have been like excessive bicycle riding, testicle transplants, exorcisms, electroshock therapy, forcing men to engage in sexual activity with female prostitutes, aversion therapy, and hypnosis. So studies have shown that many individuals who have participated in these methods experience negative side effects, which go figure. So these effects may include depression, anxiety, avoidance of intimacy altogether, sexual dysfunction, internalized heterosexism, and suicidality. So you may also want to feel for that with your client, see if they've been through any of these types of treatment in the past. LGB affirmative counseling is kind of the opposite of what we just talked about, and this is more beneficial for clients. So LGB affirmative counseling is when a counselor, being aware of their own strengths and weaknesses in working with LGB clients, is able to use a variety of counseling interventions, countering the negative societal messages often internalized by LGB clients and affirming their LGB clients. So rather than pathologizing that same-sex behavior and affection, working to understand issues affecting those who are LGB and affirming them. So once again, we do have some guidelines here. So ALGBTIC has created, and this is Association for Lesbian, Gay, Bisexual, and Transgender Issues in Counseling, and that's a division of the ACA. So they have created competencies for working with clients who are lesbian, gay, bisexual, queer, questioning, intersex, and allies. And basically, the idea here in a nutshell is that counselors should engage in self exploration, again, explore resources that deal with queer and feminist theories, emphasize non traditional approaches to therapy, and become familiar with the constructs of disclosure, positioning, and deconstruction. So, what should you guys do? So, individuals who are LGB seek counseling services more often than the general public. So, we've already talked about that. We want to keep that in mind. They also report greater dissatisfaction with services received. So, that's something else to keep in mind. And there are a multitude of reasons for this, I'm sure. But as counselors, we should, in order to try to combat this dissatisfaction, we should be aware of the attitudes and beliefs about women and LGBTQI individuals, our attitudes. So it's something that's foundational. We should constantly be aware of our own biases, and I will repeat that over and over again. Counselors must be aware of how their own race, gender, age, class status, ability level, and sexual orientation affect the counseling relationship. And this is in order to become competent when working with any diverse population. So that's what this class is all about, basically. Doing the research for yourself so that you're not constantly being educated by your clients, and then reflecting on your own biases. And then competent counselors will ask clients how they prefer to be addressed, and will use language that the client uses. Counselors need to expand the meaning of the word family. For many clients, family does not necessarily refer to biological families of origin. So your client may talk about family often, and it might have nothing to do with anyone blood related to them. So keeping that in mind. Don't assume clients presenting problems are related to their sexual orientation. Assess for any evidence of discriminatory acts, including violence, harassment, and other forms of oppression. And because outness has been correlated with self-esteem and a sense of belonging, counselors may also explore the youth's identity development, as well as the level of support in the school and home environment. And then counselors should serve as consultants for the community in order to ensure that clients who are LGBT have access to services. So lobbying and supporting policy change, giving back to the community and schools. This could be through events, talks, that kind of thing. And then collaborating with other fields can be really important as well. And that is it for this chapter.